Hello, my name is Marcela and I live in South Florida. This video has been made to inform or to share my experience and my testimony of what happened to me as a result of getting implants, breast implants to be more specific, and the nerve damage and post-surgical chronic pain after my decision to remove the implants. This video is just a disclaimer. It's a video that is not to sell anything or to suggest anyone to any type of medical treatments or anything. This is just a video I feel compelled to create because when I was going through all this situation and experiencing severe chronic pain after my surgery, I did not find much internet information on the internet, and I don't think there are many resources for people like me. I think a lot of people don't want to share about things like these because, first of all, in my case, I think I have been too sick, and it's not a sickness, but chronic pain is debilitating, and it's very hard to do things, to film a video, to send an email, to do any type of physical activity. As you can see, I'm in my home, so if you see homey things going on, it's okay. I just wanted to share my experience because when I was going through the first year of this situation, I did not find a lot of information on the internet or women speaking specifically about chronic pain, post-surgical chest pain as a result of breast surgery. And I know this is a case that happened to some percentage of women that get surgery on the chest area, on the breast area. Unfortunately, this happens to people with cancer that had received a total mastectomy, or people that just got plastic surgery like myself, or people that have choose to do a reduction, but anything involving the chest area. My experience was that after the last surgery on my chest, I developed extreme pain. The first year of my surgery, after my surgery, I was very ill. I was basically bedridden. I couldn't function for more than 5 hours a day. I wasn't able to drive. I wasn't able to open. Even up to this day, I have a hard time opening jars or lifting anything above maybe 4 or 5 pounds. Driving for a long time is exhausting for me. Talking for a long time is exhausting. You name it. Typing on the computer, playing an instrument, washing my dogs. I developed this disorder as a result of the surgery. I mean, there was a before and after. And it's been very hard on me. I don't think people understand because maybe they see you on the outside and they think everything is fine. They think that you're just doing fine. But in reality, I struggle with pain. I manage it through medication. And I've tried a lot of things. I've tried massage, physical therapy, nerve blocks, all kinds of medications, which I don't like taking medications and feeling the effects of it. So I found one medication that I take on a daily basis that it's the only medication that I think relieves the pain. And I have even been I was considering getting surgery because the pain doesn't go away. It just doesn't go away. So to explain people what happens is this. When you get surgery, I was actually reviewing my surgical clinical notes, and on the risks it's mentioned nerve damage and damage to the structures of your body, whether it's blood vessels, nerves, the fascia, the muscle. Even it even says that it can puncture your lung, or you can even die from the surgery. So I don't know, if I could turn back the time, I probably would have never got implants, because they really damaged my life. I was planning to try to conceive a child through IVF, and because of my pain, I knew I wasn't going to be able to take care of a child. So I had to grieve the loss of that dream. I haven't been able to go back to work 100%. I can barely take care of the home chores that I have and take care of myself and my dogs. And sometimes I have to take breaks throughout the day because the pain can flare up depending on the amount of physical activity that I do. And what has worked for me? The first year I tried a set of nerve blocks, and they seem to have made a difference. A nerve block is an injection of anesthesia and different, they have different chemicals they use. It could be anesthesia and steroids, or combination of medications to appease the nerves. And on the first year, that seemed to help me. After that, I just basically put ice and heat and medication, and I did stretching. And in the first year, I did a lot of exercises to try to regain my range of movement, because this whole area here is a scar. I mean, you have to, guys, look when they do an operation. If you want to look at it in 3D, look it up, and you'll see how traumatic it is for your body. They open you here, they open, or they ripped basically your pectoral muscle to put the implant, and then they seal it, right? So that in itself is horrific. So that means that I probably have a scar from here to here. And remember, a scar tissue is not a natural skin that has grown, that is not normal skin. It's a skin that has developed in ununiformal patterns. And what I have been explained by many doctors that I have visited through the time is that what happens is that when you get surgery and they cut the nerve endings, because when the doctors cut different layers of your skin, there are a lot of nerves underneath all that skin. So potentially when they're operating on you, they can cut the nerve endings. And when they stitch you back up, these nerves that have been chopped, they keep growing, but they keep growing also on the scar tissue, on this uneven type of skin, which what it does, it compresses the nerves. So the nerves regrow, and they get compressed by this scar tissue, and the scar tissue makes pressure on these nerve endings, producing the pain. So basically, the nerve endings are trapped in the adhesions on the skin, creating pain. I have also learned through different practitioners that the nerves are like nerve circuits, okay? So when they cut a nerve circuit, the nerve keeps sending the signals. The signals have to go somewhere. But when they cut them, it's like an electric cable that has been chopped and keeps like sparkling, right? So that's what chronic pain is. In my situation, it took me 4 years to figure all these things out. And to be honest, as of today, I haven't found the cure. Like I said, I treat my pain through medication, through ice packs, through rest, and a lot of prayer and meditation. I think this situation changed my life, and that's another theme. It comes to a point where you try everything and the only thing you have left is pray, because there's nothing that has been able to really help me. And I live with chronic pain as a result of plastic surgery, and I had to deal with the consequences of my actions. I have to deal with, I did this to myself too. I have a part of responsibility in what I've done to myself. And I don't know, maybe the skill of the doctor, maybe the doctor was not skilled enough to perform an explant. And I just want to share this information with the world. And I think it's a responsibility that I've been given because, like I mentioned already a few times, when I was going through all this, I had nowhere to look. I figured all this out by myself. And I saw a couple of videos of doctors explaining, but I haven't found many videos on YouTube where someone is explaining nerve damage on the breast as a result of breast surgery or anything like that. It's just not information that's available. Maybe it's not such a common issue. But I've spoken with a few reconstructive plastic surgeons, and they have explained me that there are surgeries that could potentially help, but could potentially make it worse. So I am not gonna take the risk as of now of getting surgery on the nerves. That might be information for another video, because it's very scary to get surgery there again. And I just wanted to share. I think it's my responsibility to attest of my story, and it might be helpful for someone else, or I might find someone else that can give me some feedback and say, hey, this happened to me and this helped me. Maybe I can continue making future videos where I share what I do. There's a lot of things. It's so many topics related to this problem that I'm just gonna leave it at that. But I can share in future videos the things that I do, the way I exercise, the way I sleep, the type of medication that I use, the type of clothes that I wear. How have I rebuilt my self-esteem after this situation? How do I struggle with my self-esteem up to this day? The family repercussions of this, the financial repercussions. I mean, this thing changed my life, and I don't wish this on my worst enemy. So I'm gonna leave this video there, and I hope that, in the hope that this helps anyone, or that somebody might feel comforted from my video, and that they don't feel alone, because I'm here and this is what happened to me as well. And that's all I wanted to share. Thank you.